Monday comes early. This chapter closes. A new door opens. This is the second shift.
There's nothing like a metastatic cancer diagnosis to put it in really sharp focus and say, I have got to make the impact I have while life is mine. And you want to live life, man, go have the experiences, go have the adventures, spend time with your family, do all those things that matter, not as a fatalistic experience, but if you want to have a truly fulfilling mortal life, spend less time complaining and more time just doing stuff and serving people.
Most of our guests are navigating life after medicine, or after the military, or after the corner office, or after some other high-impact career. Today's guest had that decision almost made for him. In 2022, Dr. Peter Crane was diagnosed with a large tumor that required radiation surgery and a long rehabilitation. He's a rural family physician in Idaho, full spectrum of care, delivering babies, the whole thing. And after facing the possibility that it was all over, he fought his way back. He's still practicing, and he still calls medicine the greatest profession.
So naturally, the question we wanted to ask is, what does almost losing your career teach you about why you do it in the first place? And can you really find your second shift without actually leaving?
Here's our conversation with Dr. Peter Crane. Welcome, everyone, to the 5th episode of the Second Shift Podcast. I'm your host, Dr. Brian Jepson. I'm a recently retired emergency medicine physician, but continue working as a full-time financial planner. I'm here with my co-host, Aaron Millage, who also holds a Certified Financial Planner Certificate, an MBA, and is a former Air Force fighter pilot. Today, I'm excited to introduce our guest, Dr. Peter Crane. Before I tell you a little bit more about him, I'd like to tell you how we met. Peter, do you remember?
Oh, yeah. Yeah, we were at a conference together.
Yeah, we were at the White Coat Investor Conference. It was about a year ago, and I actually met him at the crack of dawn one morning, along with his lovely wife. We were all out deciding it was a good idea at a medical / finance conference to go on a 5K run.
Well, of course, who wouldn't want to go to a conference when you're on vacation and going on a run at 6 a.m. when it's cold?
That's right. So that's how we first met, struck up a conversation. I learned a little bit about him, and we've stayed connected since then. So It's been a pleasure over that time getting to know you, Peter. And I'm excited for our guest to get to know you a little bit as well.
Thank you.
So just a quick recap on his bio, and then we'll get into some of these things in detail. But he's a graduate from the University of Utah Medical School, which is close to my heart since that was my alma mater as well. And interestingly, as speaking of the White Coat Investor, Jim Dahlia, I think, was also a graduate of the University of Utah Medical School. That's right. So we have the 3 former Utah Ute podcaster in the physician space. Think of what are the odds?
What are the odds?
Anyway, a family medicine physician in rural Idaho, which is, I would say, a dying breed, which I'd like to talk a little bit more about that and why you chose that. Also, a podcaster, Doctors Making a Difference is the name of your podcast, which is fantastic. A podcast I love. It's one of my favorites. And love to hear more about that. And then maybe most importantly, a cancer survivor. So let's get started. Aaron, why don't you kick us off?
Peter, thanks for joining us. Reading the just the about page here, what stands out immediately is the fact that you were literally hired to replace the physician who delivered you. Which I don't know how many other people. We just talked about what are the chances of 3 physicians from old Utes physicians and meeting at a White Coat Investor, but literally this is, I think, of all of the probabilities, these have the slimmest odds of getting hired to replace the physician who delivered you. So what was that like? What was that like walking into that role at that stage of your life?
Well, I mean, when you finish medical school and residency, most people are around age 30. I think I was about 31, 32. And I do remember it felt kind of surreal because it's the same office where I would used to go get sports physicals when I was a teenager. I'm like, all right, I guess I work here. And it was really interesting because the doctor who delivered me just kind of happened to be nearing the end of his career, and the hospital was looking to hire another doctor. And I wasn't sure if that's how it would actually work out, but that's what they did. He retired, and I took over the spot where he was at. It was a little bit surreal for those, I would say, those first couple of years to be in that place, because, when you're a kid, you sort of look up to the physicians in the community, especially a small community, and to be able to walk in that space, I definitely had a little bit of imposter syndrome, but it was really quite an honor. And, you work with people that, I guess it's challenging to have somebody that you held as a respected adult when you're a kid that comes and now you're their doctor. On the other hand, it was quite an honor when someone would say, like, I've got a medical issue I need help with, to be able to really have a sincere love and care for that person has been one of my deepest honors for the last 15 years that I've been back in the community.
You mentioned imposter syndrome, and it's something that Brian and I talk about, that's, it may not be unique to folks transitioning from an identity defining career into something new, to kind of, I used to be a domain expert in this, now I'm this. There is that imposter syndrome. I'm curious, in this case, you're the new guy, you're walking in, and I'm sure that, I'm curious what that imposter syndrome felt like, how you kind of worked through it, and did it affect you, and how do you eventually grow out of it?
I don't know. I think you do something for a while, and the phrase "fake it till you make it" I think is relevant, and in medicine the mantra is always see one, do one, teach one, and I think that was reflected through all of my medical career, and I think in residency that's very much how it is. You're thrown in head first, and we've taught you how to do this. Remember, you have the skills. Okay, now it's 2 a.m. and somebody's crashing. You need to intubate them, and by the way, your other attending physician is at home and they'll be here in 30 minutes. And so you have to manage it. And I think maybe that same thing, I was just kind of used to being thrown in head first on things and using my skills. And so I think in my community, I was able to kind of grow into that role a little bit, trying to help patients that would come in, and as people gain trust, and as I helped them through these different diseases, or I helped deliver their children, or I helped take care of their loved ones at the end of life, I developed a real connection and love for those individuals that have entrusted me with their care. And then it didn't really feel like I was trying to play a role. You kind of have all the different parts of your life sort of coalesce into one experience. And so it was okay to be the doctor in the community, in the clinic or the hospital, and be the person you see in the community at the sporting event or at church or wherever you encounter each other. It's really turned into a very fulfilling experience, challenging, but fulfilling.
I was just going to ask about that because, rural medicine is different. It's a different breed, right? In terms of what you have to do, especially within family practice, because, unlike if you work in a big city or in a big, community hospital where there's lots of resources around you and you play your specific role in that, as a rural physician, a family physician, you are all the roles. And, and not only that, you go, and like you just mentioned, you see your patients at the grocery store and you see them at church, and they say, "Hey, doc, what's this rash?" Like when you're trying to watch your kid's baseball game or something like that. Just wondering what led you to that decision about why you wanted to become a rural family doctor, and how it's been for you.
So I think if you interview lots of folks who choose family medicine, you'll find that they have some of the same background. They kind of liked everything. And I was one of those. I liked surgery. I liked the emergency room. I liked pediatrics. I liked obstetrics. And I really, truly liked each of those. And I could have seen myself doing any one of those specialties. But then I think what I observed in my rotations is in some places, especially more urban areas, or just suburban even, some of the family docs were really kind of restricted because there were so many specialties, and the standard of care or the expectation is, well, if you have a heart thing, you're going to go to a cardiologist. If you have obstetrics, you're going to be at a gynecologist, and you could split the care into 10 different specialties. And I don't think I would have done family medicine. For me, it just didn't work to just be kind of the person that's kind of following algorithms and managing chronic disease and, being the center of a referral machine. And it's not that I don't do that. I have lots of people I refer to, and I'm honored to do it. But rural medicine really attracted me, regardless of the ability to come back to my own hometown, because I could see that it was very fulfilling as a doctor. I could use every skill, every single rotation I was on in medical school and residency. I would put this down, like, I'll probably have to use this skill. And I still do, for sure. I don't think there's a single thing I've learned that I don't use on my routine life. it's almost like it should be rural medicine. Like you say, it's almost hard to find people that carry on that role, but it is its own unique specialty. When I talk to my family medicine colleagues who work in a different setting, it's just really hard to kind of be on the same page, because very few people say, well, who did the C-section? Well, I did. Who worked in the ER and worked that person up and intubated? Well, I did. You know, who took care of him in the ICU for the first 18 hours when there was a blizzard? Well, I did. You know, and it's such an interesting dynamic experience. It's forced me to be a lifelong learner, which I've loved. But I think that's really what, as an excited medical student, that's why I wanted to do it. You get to do everything, but on the flip side, you also have to do everything, so it can present lots of challenges.
Professionally, did that create any sort of like isolation? Since, you know, it sounds like from a cohort perspective, you're sort of a rare breed, and like you said, when you talk to colleagues, maybe they don't get it, maybe they don't understand, maybe it sort of blows their minds. Professionally, does that create some isolation?
Sometimes. You know, what I've found is I have excellent colleagues. In the 15 years I've been here, we've ranged from 3 to 6 doctors that kind of have a not the same necessarily. People kind of come in with different expertise on things, but somewhere between 3 to 5 doctors that kind of do that same breadth of experience. And so locally I have folks that I work with. And then the second thing I found is, as I go to medical conferences, or like in my state medical chapter, I found, especially in Idaho where I work, there are quite a few communities that have doctors that do what I do. And when you see someone that kind of has done it for a while, and you recognize, like, oh yeah, you get it, you understand what this is like. And I've found that there's a lot of collegiality and a lot of understanding. It's not like people think that they're better than anybody else. It's just understanding the circumstances of rural medicine. Like, very often you are the only one, and you can call people and they can drive in from however far they are away, but you have to be able to think on your feet. And like I say, it's challenging, but it's also quite an honor to be able to do it.
So let me ask, Peter, with the burnout rate so high in medicine, and you assuming this role as the be-all physician for your patients in that community, how do you manage it? How do you balance that with life and, you know, the podcasting and everything else you're doing? How do you maintain the balance so that you don't become one of the statistics?
Yeah. Well, I guess there's 2 points on that. One is I could never do it alone. It would be impossible. We had a time where we had some shakeup in our hospital leadership, and quite a few of the staff left a few years ago. And it really came down to 2 of us that were doing that broad spectrum care for about 18 months. And that was very hard. You know, that was the only time where I felt like I was just completely overwhelmed, because there was only 2 of us and you couldn't leave town. You know, me and the other physician that did it really had to kind of be tag team, like, okay, I'm going to be gone for 45 minutes. When are you going to be here? Because it was too much. So having a team of, you know, 4 or 5 of the folks that can do it, I would say that's number one, is my colleagues. And then the second thing, you know, it's more of a time management thing that I think people talk about, and I certainly don't have it figured out, but I've just tried to be present wherever I'm at. I know it sounds simple, but if I say, look, I'm at work, you have my full undivided attention. I am here for you. And when I leave work, when I'm at home, I try to say, you have my full undivided attention. And it's really hard because there's so many different facets of it. And sometimes work comes home even though I don't want it to, because you get some kind of horribly difficult trauma on someone that you know and love. But I have just found that being present helps me. And then trying to really find, okay, what is about this relationship with this person I'm talking to matters, and the relationships are what keep me coming back. You know, if I would say I would want someone to show up in my disaster, my emergency, my challenge, and when you have that level of love and respect for somebody, it doesn't feel like you're doing an onerous duty. It feels like you're there to really help a friend or someone in need.
Yeah, honestly, I think that's why emergency medicine has such a high burnout rate, is that we don't have, you know, just in emergency medicine, we don't have the opportunity to create those relationships. And so that's, I can definitely see that value in the type of medicine that you do.
Yeah. On the flip side, one of the benefits of not knowing everybody that comes in the ER, because most of the time, 9 out of 10 times when somebody comes to the emergency room, because I always cover the ER as well, 9 out of 10 times I've met them before somewhere, or I've taking care of a family member, or they're visiting a relative that lives in the area or something like that. And that's wonderful to be able to be like, oh yeah, how's it going? And you kind of get to know people. On the bad side, when somebody comes in and has a really challenging, unexpected disaster and your ability to help is limited, it's soul crushing, because it's not someone that is someone you can just think like, well, that was a rough time to have that patient have that problem. That's also a person that goes to my community or has kids in the same school as my kids, and so it can be challenging for sure.
Yeah, I'm sure that's true. But, I think that given that, you probably feel less commoditized than many physicians might, where it's like, I do my shift and then go home.
Yeah.
And
I found that it kind of depends on, we've had different administrators over the years who have dabbled in that, trying to treat their medical staff as a commodity. And in those times when we had one a few years ago that was particularly challenging, and you felt like you were just an asset to be managed, and it didn't really matter what we say, we're just going to have you do the shifts no matter how much. And at those times, yeah, everybody feels burned out and frustrated and angry. But when you say, look, I'm taking care of a team, this is my little medical family, I'll do anything for those people, and that approach leads to excellent outcomes and satisfaction for the employees, all across the entire systems. So it is challenging to manage burnout for sure. But I think people will do difficult things if they have a time horizon and they know the people they're serving and they're invested in the outcome. And if you give people those kind of parameters, they'll perform amazingly well, and then they're happy to do it.
Yeah. So tell us, our podcast is about second shifts and about life changes and career changes, and you are still a full-time practicing physician, but tell us a little bit more about your life story that put that at risk.
So, as you alluded to at the beginning of the podcast, I also am living a life with treating cancer, which I don't really recommend. I think that's what you're talking about, right, Brian?
Yeah, absolutely.
Yeah. So, I guess others who might have listened to my podcast have heard some of the story, but we had gone on when I was 43, just a couple of years ago. We had gone on a trip to Italy, and so I was jet lagged. We came back, and I was just laying in bed one morning at like 4:30 awake because my brain was on a different time zone, and I woke up with my hand just on my abdomen. I just was there, and so I noticed that my left side of my abdomen had this huge mass, and I don't know why I hadn't felt it before. It just, I don't know. Usually you don't sit there and just feel your stomach unless it hurts or something. But I had no pain or anything. I just noticed that there was a bump, and I'm like, what is that? And I thought maybe I had an enlarged spleen or something, maybe related to the trip. I didn't know what it was. But I felt well. I'd lost about 10 pounds, but I'd also been exercising and trying to be healthy. And I'd had a little bit of swelling in my legs when we went on that trip to Italy, but I kind of attributed it to a long airplane ride. And I thought, well, maybe that's just what happens when you turn 43. But so as the long and short is, I saw my practice partner, and I saw him in clinic that next day because I said, come check this out. And he was worried enough about it. He ordered a CT scan and discovered a 26 centimeter sarcoma. I mean, like a baseball bat to the face sort of a experience to be like, whoa. In fact, maybe I told you this, Brian, before we talked, I found it. I was working in the ER that night, and I just happened to have the PACS system pulled up for another patient, and I couldn't help myself. I clicked on mine just to see the report, and I was like, oh my goodness, there it is. It's a 26 centimeter likely sarcoma. And I just couldn't believe it. I had to go back to work. I had patients waiting for me in the ER, and I had to just kind of, wipe away the shock and go back to seeing patients. And my patients, my colleagues, as they kind of found out what was going on, were more than gracious about it. But yeah, life altering, crazy, and when you get that kind of news unexpectedly, it was certainly a shift, as you alluded to.
Did being a physician, did the medical knowledge make it easier or harder? I mean, you mentioned like the compartmentalization of you're at work, you see it, you're back to work. But as you sort of dwell on it and you're tapping into your own medical knowledge, easier, harder? How did that affect, like as this information is coming to you?
Well, the story unfolds as you can imagine. I know that tumors usually have, if they're that big, have to have radiation and surgery and chemotherapy and all the things. So that side of it, I kind of knew, but I don't know. In some ways, it almost made it worse because instead of saying like, well, I don't know what this is, it's a likely sarcoma. Big sarcomas don't have a good survival rate. You have all that information, and yet what I'm really worried about is how can I get through this shift? What do I tell my family? I was almost embarrassed about it. How can I'm supposed to be helping people. How can I be the one to have this horrible thing go on? And how could I have missed it? And it's just so many complicated feelings at the time. But I would say that in balance, I was glad that I had the medical knowledge because I knew what to expect. And I know I've told Brian this before, but it's certainly that experience of being a physician and a patient and having that knowledge and engaging with the medical system regularly over those next few months and even now to go in and do chemotherapy and radiation and surgery. I was just blown away by the compassion and skill of my colleagues who took care of me. And at the same time, most every day I would do those treatments, and then I'd put on my doctor hat and go back and be a doctor. And it's such an interesting juxtaposition.
Yeah, I was going to ask about that because I think when you're in that situation, I would imagine that you see both good and bad. So my question is, who showed up for you, and what were some of the good and maybe some of the bad that you experienced that has changed how you have approached patients as now a former cancer patient? Yeah.
So, to be clear, I have metastases and I still have to take chemotherapy. That's my lived reality. So it's still a challenge, but who showed up for me? Like I say, that was, again, my initial impression was like, oh my goodness, how's this going to turn out? And, you feel like the sky is falling, and yet just have to compartmentalize and say, okay, I'm going to get back to work and take care of this patient and do what I need to do, like you always do as a physician. I felt initially almost like I was racing against time. I can't take time off because I got to take time off for the surgery. What if I can never work again? I need to make sure that my financial house is in order so that when I take all this time off, that we can be okay as a family. We can still make the payments and the commitments that we've made. And I think at the beginning, I was a little bit short-sighted about I got to get to this right now. In fact, during radiation for 6 weeks, I definitely would drive an hour and a half each direction every morning. And then eventually I got sick enough I had to have somebody else drive me there and back. But I would still go to work every day. I'd just be 3 hours late and I'd still go to work because I wanted to show up and take care of my responsibilities. And I figured I needed to save my time off for the surgery. And I was so thankful for the radiation oncologist and the general oncologist and the surgical oncologist and my primary care doctor. But they really did show up for me and help me so much. In hindsight, I probably should have taken a little more time off and allowed myself to go through something that was a little bit challenging. But at the time, my practice partner of the previous 10 years had announced he was leaving to the community, and it was kind of rough timing. So me leaving meant my patients had no doctor. And so I felt compelled, and I wanted to continue to be there for them until we figured out something else. So it was certainly a challenging time for sure.
Did you, when you mentioned showing up to work and serving and kind of fulfilling those responsibilities, what did you entertain the possibility that this could lead? I mean, the mortality aside, was there any part of you that sort of dwelt on the possibility that you may never be able to serve as a physician again? And if so, how did that land with you?
Yeah, no, for sure. That's the big unknown. And even now, none of us really, in mortality, none of us really know what we're going to be able to be like the next day. We live with this assumption that we'll be able to be well for years, but it puts it in such sharp focus when you have something like this. Like I said before, I really wanted to not leave my patients in a lurch, which was, maybe a little bit short-sighted, but at the same time, I really wanted to make sure we took care of them. And I had, I just wanted to mention this. I had two colleagues from residency, two really great men that I'd been friends with at that time, who found out about it. And I mean, this is incredible. Both of them had just made a change in their lives with their careers and had opened up. One of them had started doing some locums work, and the other one had just shifted to a job that had some telemedicine capability. And just unbeknownst to me, of course, that they had made these changes. But in both cases, they said, "Hey, Peter, if you need us to come do your job for 2 months or 3 months while you recover from surgery, we're there." And they did. Both of them. One was in Alaska, one was in Virginia. They picked up, and the hospital hired them, kind of temporarily, put them up in a housing. And for 2 months, they just did my job. Both of them showed up to the clinic every day. Because as I mentioned, my practice partner had left. There would be no physicians in that clinic during that time. And they showed up and just did it. And it gave me some time to reflect on what you were just asking, Aaron. Can I work again? What is this going to be like? What's my capability? Because as you probably know, when you do a large exploratory surgery for a big tumor, you have to have an R0. You're looking for an R0 resection of the tumor, which means you remove whatever it takes. And I was told I would lose my left kidney, my left hemicolon, and probably have a bunch of changes in my body because of it. Thankfully, I was able to keep those parts, but I did have some very significant left leg weakness and had to do therapy for months. But I didn't know if I would ever be able to return back to work. There was no way to possibly know that. I hoped that I would, but it gave me just tremendous respect. And I know I've told Brian this before, but as I was laying there recovering and thinking about, do I get to do this again? What would I do if I got to do it again? You kind of sit and replaying all that stuff in your mind. And the thing that came is just this clear thought is, if I got to do it again, I'd be a physician. I'd want to be a part of this team of healers that make an incredible difference to a person's life and show up and gather decades worth of experience to make a tremendous difference. And I don't know, it just struck me so hard. It's really why I kind of started the podcast, and all the rest is I want to highlight and empower doctors that are making this incredible differences in somebody's life. And I am so thankful that they have helped me and continue to help me, and that I got to return back to the workforce.
Before we talk about the podcast, and I do want to get into that, but let me ask you this. How are you different as a physician now after what you've been through, and as a cancer patient? How has that changed whether it's your bedside manner or how you approach the job or anything like that? And maybe it hasn't changed you, but I'm just curious if it has.
Well, like every life experience, changes a person, and you never are really quite the same one day to the next, because you're improving. A tumor diagnosis and being an ongoing patient, I guess it makes me a little bit more compassionate. I don't think I was an uncompassionate person before, but I definitely, when somebody comes in and says, "Hey, I have this horrible thing and I'm going through this," I feel like I can relate a little bit better. And when somebody comes to ask me to fill out disability paperwork or something that, is paperwork, who likes to do paperwork, I'm less annoyed by it. I feel like, okay, if that's something that will really help you to get what you need so that you can heal and recover and get back to your family, sign me up. I want to be there to help. And so and my patients, because I'm in a small community, most of them know that I go through this, because it's hard to keep those kind of things quiet in a small community. So most of the time, I'd say 9 out of 10 interactions, the patients know me, and I want to know how they're doing, and we try not to spend too much time on it, because there's always a finite amount of time in visits. But they want to know how I'm doing too, and so I think it adds a measure of understanding. So patients like, "Oh yeah, let's go to Dr. Crane. He knows what it's like to go through this," and I do, and it's hard. Very often, I go to the hospital in the morning, get my IV started, do my infusion. And then the nurses are, they're nice, but they're calling like, "Hey, when are you going to come up and round on Mrs. So-and-so? Or when are you going to come up here? We've got a baby that's supposed to be delivered. When are you going to be up here?" I'm like, "I got to get the IV out of my arm and I'll be right up." And it's this weird thing, but I'm living this life routinely, and it's challenging, but it is my lived reality.
So, I mean, I'll be honest with you, that the painting that picture and then seeing what, how you tie that into the story, to the podcast, to like your mission of help others finding joy, working as a physician. You mentioned kind of this juxtaposition of your lived reality. Like, I mean, finding joy in this situation is in and of itself a juxtaposition. And so, you say you still find joy in medicine. You're helping others pursue that. That's almost like a dirty word, right? That's countercultural. We don't talk about joy in medicine. We talk about burnout. So how do you do that? And what do you see as like the common thread among physicians that you talk to?
So I still think being a physician is the greatest profession. I mean, it's hard. Like, there's lots of burnout. The systems are broken. All the money seems to flow to people that don't make the right decisions. There's lots of stuff that we can talk about what's wrong. And I'm not denying any of those things that are wrong. But really, when you think about why you went to medical school and what made you choose to do that, it wasn't so you could make RVUs and fill out somebody's EMR documentation and meet somebody's productivity requirements. You wanted to help people. You wanted to make a difference. And it's the most unique job because it's not just like, well, you've got a problem and we'll work on it. You're right in the details of somebody's life, and everything hinges on that moment, like how you talk to the person, what decisions you make. So when I go to my doctor's appointments, especially at that time when everything was so chaotic and uncertain, you just hang on every word, like what's going on, what do they expect? And so it's such a unique job. And if all we do is talk about how hard it is and how difficult it is, we're going to drive our best and brightest away from medicine. And I think we need to work from within to fix it and make it better so that people can get back to caring. And I hate that it's become such a productivity business driven thing, because that is really important to keep the lights on. But really, we should be focused on how do I make the biggest difference and impact for my patient? And doctors need to still be in the driver's seat on those decisions. So I feel like there's got to be more of an upswelling of physicians who rise and say, I'll take the leadership role. We'll decide together what's best for patients. And usually what's best for patients is usually what's best for doctors too. You work through it. And those are the things that make the most sense. What's best for business practice and income don't always match that, but we have to be involved in those discussions. And I just found, as Aaron, you asked what I found as I talked to people on the podcast, I have found an amazing group of doctors who are caring and uniquely qualified to help people. And some of them have carried that mission, of the duty to kind of serve humanity in their own community. Some have taken it, worldwide and done stuff. Some have done it through education. But there's a tremendous number of people who still get it, and they still remember why they're doing what they do. And those are the ones that patients love to come to. And I think they really matter. We have to be careful not to drive everybody away from medicine.
Yeah, I think, I love your podcast. First, let me say that because I do think it has a different tone than many of the podcasts, the physician, medicine podcasts. And it is, you're a champion of the field, and you interview people who are doing very cool things within medicine. One thing I noticed that is a lot of the guests have had their own challenges that they've faced or overcome, or created a shift in their thinking, or reinforced their career choice or whatever. But do you have anything to say about that? Because I've noticed that with your guests as well, is that they're unique individuals that have, and I don't want to say unique as in uncommon. I think there's a lot of people that go through that and just don't necessarily share their story. But what are some of the things that you've learned from your guests about how they took their challenges and help them to create joy in spite of them?
Well, to have challenges is to be mortal. Everybody has them. They really do. And I think that's why medicine, by being a physician, is such a unique job. Is you're helping people, but it's all about the individual in front of you. And when doctors discover that, especially if they've been in challenging circumstances themselves, they get it and say, like, I have this unique skill set, and with the skills and knowledge that medicine has to bring, we can make life better. We can alleviate suffering and improve disease and help you live longer and better. And when people understand that, it is awesome. I've just really loved meeting so many of my guests. I recently had an episode with Dr. Stuart Clive. You might have listened to that one. A really interesting, compassionate ER doc. And he discovered the idea that maybe he could do it after he'd kind of hit his FI number, his financial independence number. Maybe he could dedicate an entire year's salary to help to cure blindness in Ghana. And he did. And he's still working. He's like, work is so much cooler now because I realize that every dollar I'm earning isn't just to fill up my bank account or to pay off my mortgage. Every dollar I earn is going to make a life-changing difference to somebody in a different place. I mean, and folks like that just so impactful because you realize there's challenges and it's easy to get burned out. And like, I've got to find something else. Maybe I should just leave medicine and find another source of income altogether. But a lot of people find a way to stay engaged. I would say one of the other things on that, Brian, is one of the foci of the podcast is to give doctors tools, kind of like what you're doing, with financial tools, coping tools, connectivity tools, advocacy tools, so that you can stay in medicine and not be controlled. You're going to be a better doctor if you're financially independent or on the path to financial independence because you're not being constrained by an external system as much. And I think all that stuff is a conversation we have to have. Otherwise, we really will just talk about the negative because there's lots of it.
So in tying that of kind of not necessarily the financial aspect, but thinking about how those resources, the tools in the tool belt, even elements or layers of advocacy assist in Brian and I kind of talk in the context of life after high impact careers. You almost had that transition forced on you. So what did that teach you in light of all of those, sort of all of the tools that you just mentioned, that you share with your guests on the podcast, that they share with you? What did you kind of get from the experiences as you were kind of steering this second shift, like it or not, that was happening to you?
I mean, life is finite, and I think we all know it. As a physician, you really see it day by day. You face disease every day, and you see what it's like, and generally you have a pretty good idea if it can be fixed or not. But there's nothing like a metastatic cancer diagnosis to put it in really sharp focus and say that I have got to make the impact I have while life is mine, and you want to live life. And I think we all know that, but man, go have the experiences, go have the adventures, spend time with your family, do all those things that matter, not as a fatalistic experience, but if you want to have a truly fulfilling mortal life, spend less time complaining and more time just doing stuff and serving people. Because as one physician, I can't change the entire system and I can't fix everybody. There's no way to do it, but I can make the impact on the individuals that come to me for their care. And maybe the only people in life that will ever even remember that I existed are my own kids and my family and the people in my community. And I want to have a tremendous impact on them. But I would say maybe the biggest shift in thinking, like the second shift, is just to say, don't put things off. We all know that, we hear it, but really, if you want to have an impact, you want to make some changes in your life, act on it now and make the little incremental changes so that life looks like the way you want it to look to the best of your possibility. And then the other is just, amplify, scale your impact. There's some stuff that you can really do to make a difference to people that you don't know, but you can especially make a difference to the people in your sphere, the people you do know.
Yeah, I recently wrote an article on Doximity about a colleague of mine who died of cancer recently. And it made a big impact on, I think, on a lot of those who read it, judging on the comments that were given. And a lot of it was coming from, a lot of the comments were coming from physicians who had retired or were close to retiring, or for various reasons. And one of the themes that was pretty consistent was regretting spending the time that they wish that they could reclaim. And to your point, you can always earn more money, but you can never reclaim your time. Right. And if you're so focused on earning money that you are destroying relationships or not fulfilling relationships, even if they're not destroyed. You're not creating the deep and meaningful relationships that you otherwise could be spending time doing. I think you're missing the boat. And nothing like a cancer diagnosis to kind of bring that to the forefront, I would assume.
Oh yeah. Just like you said, when you measure how life has been and all the different things, like you have to have all the financial resources to be able to spend time with the people you love and doing things that bring you fulfillment and joy. But really, I just remember at that time, specifically in a couple of years ago when I found that tumor, all the other things that I was worried about RVUs and who's going to do this so we can make sure we have time off for this, and how are we going to take our vacation time, and how so-and-so is mad at so-and-so, some relationship. I just remember all of that suddenly just paling in comparison, not even being meaningful. Like, why are we worried about this? It's like the little kids fighting over the yellow crayon. It doesn't even matter. Why are we so worried about all this garbage? Really, it should be about relationships and about building trust and spending time with the people you love. And if you have that perspective and realize that all the squabbling we do as humanity, it really is kind of on that same level as little kids squabbling over the crayons. Really, if you have that perspective and you realize it's all about relationships and how you have time freedom and the ability to spend time doing the things that you love and nurturing those relationships, then everything else kind of falls into line, because it's all about those interactions. And then you're earning money so that you can have this experience, or you're taking time off so that you can have this experience, or you're taking a second shift or retiring or changing so that you can do this meaningful and fulfilling opportunity. Having money or having resources should be a means to an end.
Yeah, I appreciate that. And it's very true. The finances are important, right? Financial planning is important because it helps you to create those opportunities. But if in and of itself, if you don't take advantage of the opportunities, you're going towards the wrong goal. And once you get there, you'll find yourself unfulfilled, I'm afraid. And so I think that was really well said and a good point. Aaron, you ready for the reckoning, or do you have any other questions?
Well, yeah, I have one more question. It'll actually feed in to the reckoning. So
you got me nervous about the reckoning.
I know. Well, that's the whole point. Good. Like this is it works then. So if anything were to happen, just tumor or otherwise, and you found out that you couldn't practice, what would be your plan? And I ask that because when you say these sort of life, your broad aperture on what's important, right? Like some people would approach it from a very nihilistic thing of like, you know what, I'm going to go live the best life that I can and eat, drink, and be merry. Your focus was on sort of looking beyond and outside and of yourself. And so, what would life look like for you if you couldn't practice, knowing that you do extract this joy from healing, from serving others, from the responsibility to kind of humanity?
It's a great question, Aaron. None of us know the cards we're going to be dealt. It's impossible to know. But I thought about that, and I thought about it a lot because I truly didn't know a couple of years ago if I'd be able to return to medicine. So what would I do with the time I've got left? And if maybe one of the bigger challenges is you say like, okay, well, I get to be alive, but I don't get to do some of the things. Like a lot of the patients that I work with, are living with some kind of a profound disability, and it's challenging. How would you still have an impact and do something that's meaningful? And I don't know that I have the full answer worked out on that. It certainly brought a lot of thought. One of the first thoughts was like, how's my disability insurance? Have I figured out how I would remain able to just meet the standards of the obligations we've committed to pay for? Or how would my wife and my children manage without me? I mean, those are all really important things. If I couldn't work as a physician, I hope that I would still be able to write or do something to impact the field of my profession. I hope that I would still be able to have impact on my children and be a part of their lives. And I hope that I would still find find meaningful work, but I certainly don't have it all figured out, because as long as I feel well, I want to be able to do all that I can. But the future is unknown. I've been on chemotherapy for a year, which is hard, but I feel really blessed that it seems to be holding it at bay. The cancer I have is called solitary fibrous tumor, just to bring a little bit of awareness to that. It's a rare type of sarcoma. There are no known cures, but there are some treatments that seem to slow it down. So as long as it'll be really slow, I hope I get to live a long life, and that I hope that it can be meaningful and impactful. And I hope that, if nothing else, I hope my children can see that there is some positive in this world, and you have to go hunting for it. But if you want someone to talk to you about negative, that's easy to find. But if you want to find something you can actually make an impact on and help individuals, it's worth going and pursuing.
That's great. And I'm glad we asked that question, because I think that Brian and I would agree that the bar is low for common decency and for finding people that will talk to you about the good, right? It's easy to just be a bitter, cynical old guy, the curmudgeon yelling at kids on the front lawn.
Right.
Well, Peter, I appreciate you for sharing your story also. I mean, I think it's important for when we do face challenges, and as we're trying to figure it out. I don't think we have to wait until we figure it out, because we may not completely figure out the right way to do things. But I think as we go through that struggle, other people who are facing that challenge or similar challenges can just gain some strength from that. And so I think it's wonderful that you're doing that. I think it's wonderful that you're championing other physicians that are doing that on your podcast. And so we just really appreciate you being a guest today.
Happy to be here. Thank you, Brian.
Okay. Are you ready for the reckoning now?
Let's go for it.
Okay. So what I love is you mentioned these, larger than yourself, these kind of lofty pursuits of things and engagements that bring joy. But I'm curious, through all of this, what's the smallest thing that brings you joy now that you never noticed before?
The smallest thing. It's the absence of nausea. That's a terrible thing. It's a small thing. You never thought about it when you're not on chemotherapy. You never even think about not feeling like yucky and nauseated. But it's just something I never really took for granted, I never really appreciated to its full extent. And now on the days when I'm not on treatment, I'm like, yes, I feel great. Let's go do stuff. And it's, I survive on the other days, and I do fine. I'm thankful that there's some treatments to survive it, but it is a little thing that you just never appreciated how awesome that feeling is, because it was just normal. And I guess that's part of maybe that's TMI, but that's my lived reality. I'm so thankful on the days when I don't feel yucky.
That's right. No, I appreciate that. So if you could go back and tell your pre-diagnosis self one thing, what would that be?
Don't be so worried about everything. I mean, truly, you get so much in the weeds and the details of how am I going to accomplish this financial goal? Is this going to work out? Or how are we going to, and that's part of the stewardship of our lives, is to make sure we attend to those details, but investing so much worry and stewing about so many little things that just don't matter that much. Spend time with your loved ones and build relationships, and the kids are going to turn out fine, and the job is probably going to continue to provide an income. And if you lose that job, you probably find another one. And it's not that we should be just forget about our worries, because like I said, that's part of the responsibilities of this life. But it is so important to just say, I got to see past it and look for the moments. Go take the kids backpacking and camping and do all those adventures when you have them. When my wife and I got married years ago, I was really thankful we had, as a bishop and ecclesiastical leader, that gave us some advice. He said, go have the adventures while you're young. Do it now. He said, don't spend a lot of money, but if it sounds fun to you to go do some adventure or go on some trip, do it when it sounds fun. Save up a little bit and do it. Because if you wait and do everything when you're 65, the thing you thought was going to be fun won't be fun anymore. It just won't. It'll be a different chapter of your life. And I was thankful for that advice. And we've tried to hearken to that, continue to have adventures throughout all of our married life. But I think that should apply to all of life. Just don't worry so much about everything. Go enjoy it and spend time with the people you love. That's the thing that I think I've tried to do it, but I think I could have done better. And that if I were to go back and shout something in my ear, that's probably what I would say.
Okay. That's excellent answer. You're doing well. This is the reckoning is
Right,
not an issue for you. Okay. Last question. What's the question you ask yourself at 3 a.m. when you're staring up at the ceiling fan that you don't actually have an answer for?
That one's a little more challenging. Yeah, I don't have the answer to so many things, so I'm trying to figure out which one to highlight. I just can't know the future. And I guess that's when I am in my moments of hardest doubt, when you don't know quite what's going to happen next. I guess the thing I worry about the most is, since you can't know the future, I mostly worry about my kids. And I try not to worry about them, because they're good kids and they're going to turn out fine. But I mostly I want to be there for them. When you get this kind of a diagnosis, when you still have kids in elementary school, it is really alarming. You realize, like, I want to be there for the next year. I want to be there for the next 5 years, and I want to be there for the next 20 years, but it's uncertain. And so that uncertainty about the future really is part of our experience for every person. We can't know that. You cannot know what the future comes, but I try not to stew about it too much. I just try to live life in real time and try to be positive and upbeat. But I think that's part of the reality for everybody that has some kind of uncertain diagnosis. You hope for today is great, and you hope that future years are going to be good, but it is a little bit hard to plan into the distant future.
Awesome. Thank you, Peter.
Yeah.
So, Dr. Peter Crane, thank you so much for joining us. I mean, I think you've given us some great things to think about. We appreciate you sharing your experience. I think that the experience of challenges help mold us into the people that we are, and I can definitely see how that's molded your passion towards medicine and helping others. And even though it was there before, I think that it's really kind of solidified that, and you're doing a great job with your podcast. So thanks again. So we'll close it here. We usually have a little bit of a recap between Aaron and I afterward to just talk about you without you being here and staring at us.
I'll try not to have my ears burn.
Yeah. Well, you can cut that part off when you're going back to listen to it if you'd like. But
thank you so much.
It's been great.
Yeah, thanks for having me on, and it was nice to visit with both of you. Appreciate it.
Okay. Take care.
Thanks, guys. Brian, you and I, by ourselves in the debrief, reflecting and unpacking what Dr. Crane shared with us. Most of the guests that we have, let's be honest, are leaving, exiting, running from their careers, and Peter ran back to his.
Yeah, I mean, it's interesting, and that's one of the reasons that I wanted to ask Peter to be a guest, because it's a different mentality, right? Where again, many of us, whether we're running or just transitioning to something different, we're looking for other things to help fulfill us. And Peter, on the other hand, realized what fulfilled him. And it was becoming the best physician that he could be and taking care of the patients the best that he can be. And that was almost taken away from him. So I thought it was a good perspective that transitions can happen within a career, not necessarily external to a career.
In especially what struck was his devotion to the present, right? And not just, I guess I should just say a blanket, like, oh, he's always present. He is deliberately present in sort of the environment that he's in. And some of us would say, well, that's just avoidance and you're compartmentalizing, and that leads to, therapy bills down the road. But it sounds like, he has figured out that present as a physician, and in giving, that focus and attention and duty of care to patients, and then present as a husband, father, kind of figure in the community. He's figured that out. And so I wonder, as we kind of talk and look back at the other guests, most folks, I think a common thread of the second shift set is there is always an eye to the future. And some of that is sort of a downstream effect of lifetime learning. You kind of learn something, and then you sort of like let the intellectual exercise say like, oh, I wonder if I could do that, or like, what would that look like if I pursued this, down the road? How do I grow into this, whatever? And again, that can be a wonderful, virtuous trait, but taken to the extreme, I think that the risk is that we miss being present. And that obviously, as he's talking about that, I'm like, oh, I wonder if I'm reflecting on my own life of like, how am I not present with each element of my identity, right? Like, how am I not present at work? How am I not present at home? The streams cross. I don't know. That was really impactful that he said he broke that down.
Yeah. I mean, I think there's nothing like a terminal illness to give you perspective, right? And many of us don't get that opportunity because we're not facing a terminal illness that we're aware of at the time, right? So it's very easy. Yeah. It's very easy to just live our life and keep planning and putting things off like we all tend to do. But when you are faced with the terminal illness, all of a sudden your perspective changes, and because you realize the present may be your future, that may be all you have, right?
Oh, that's valid, yeah. And
so you have to pull that future away from future into the present and say, okay, well, what's important? What's actually important to me? And how do I make that happen now? Because I don't know how much longer I'm going to have to live that. And I think that doesn't take away the importance of planning for the future. And he made a good point of that and saying, okay, well, I'm sure glad I had disability insurance. I'm sure glad that we, had our debt under control, because, and I'm sure glad that I've made steps to create financial independence, because now that provides optionality, right? So that you can focus more on the things that are important now and in the future. And I love that perspective from him, because it's, it reminds us all that we probably don't do a great job of that. And this is the second guess, and something that I felt, when I hear your reckoning questions, about looking back and what would you tell your previous self or whatever, it's the same thing. It's stop worrying so much. I mean, plan, but don't worry so much, and just be able to live your life more in the moment. Which for a financial planners,
right? Yeah,
that seems a little counterintuitive that we should be emphasizing that, but then again, I have lots of clients who have plenty of assets who still have trouble doing that. They still keep putting things off when they should just be spending and doing, so I think we create habits in ourselves that are hard to break.
Yeah, no, I think that's 100% true. And I've had the same experience of, you've, I think it's easy to, again, on some level, the uncertainty of the future can be used in a way that creates this false sense of accomplishment, meaning that, well, I don't really know what the future is, but man, this plan on paper looks great, right? And I sort of use that as an avoidance technique to dealing with the present, and not even dealing with the present, but like you said, like giving permission to enjoy these, each season of life as it's given to us. And I know that is, that's a struggle both professionally to kind of reconcile that with clients. Like, hey, like you guys, like at some point I feel weird because we're therapists, because like, hey, you guys can spend. And I hear you saying that you value all these things that are the right here and right now. But like that value diminishes because this season goes away when your kids are, this, or when you are unable to do that. Yeah. So it's okay to kind of use your time, talents, and treasure right now to how you want to express your value or what brings the joy to your family. So it's a difficult balance, and I think Peter did a good job of kind of acknowledging that tension, and then walking that line.
Yeah. Yeah, I like the point that he made, that I think he said his church leader advised him, where do what sounds fun now, because when you're 65, it might not sound fun anymore. But
Yep.
but when you're 65 or 75 or 85, what you have is memories. I mean, that's really what your assets are, right?
Yeah.
Is
Yeah.
your life memory. And if you've wasted your life not creating those memories, then it might be too late when you're sitting on your deathbed and not able to do the things that you professed that you wanted to do throughout the earlier years. And so, I mean, you're right. I think it's a balance. The other side of that is not planning, not being judicious, just wasting not being able to create assets where you're just wasting your income and not creating optionality for you in the future. But I think it's a balance that, especially those who are kind of planner mentality, it's easy to struggle with.
What didn't we get to, do you think? I can think of one thing, but I'm curious if you had anything in mind that man, I wish we had asked this.
You say yours, and I'll think if I can come up with anything in the meantime.
I want to know, is and maybe this is a discussion for us, but is finding joy in the work realistic? Is it just, can everybody get to that point? And has he had conversations with physicians where he's just like, no, there's no coming back for this guy?
Yeah, I mean, that'd be a good question to ask him. I think most of the people that he probably has on his podcast are excuse me, kind of self-selected.
True. Yeah.
Those who have overcome and have been able to find joy in whatever else they're doing by definition, or else they probably wouldn't have come to share that with others. But I think that a lot of that depends on how just your general approach to life. I mean, I think whether you're a physician or someone in the military or, someone who works at Walmart, I think that you see people who, regardless of the circumstances, find joy in it. And you see others that, regardless of the circumstances, can't.
Yeah.
And so I think being able to cultivate that joyful side is a skill and maybe a personality trait, but something that you can everybody can work on if you choose to. And really, it doesn't take much, honestly. It's kind of like what we talked about with Dr. Schufelt is, how low the bar
right.
kindness actually is, where you don't need to donate a bunch of money to any organization to be considered generous. You can be generous with your time, with your just kind words or just a smile or just, it's not as hard to do as I think we make it out to be. And I think once you start doing it, it can feed on itself.
Yeah, no, I think that there's a lot of onus on us, right? To kind of, I don't want to say manufacture the joy, but give the opportunity to find. And I'm reminded when I was a young pilot instructor trainee, brand new, like second lieutenant, was learning how to teach in the jet that I was in, and class had started already. And this old, he was my age at the time, so now he's old, obviously.
Ancient.
He I know, right? Like, yeah, when 40 was ancient. Lieutenant Colonel runs into the class, and he's like an hour into the class, and he's so excited to be there. And I'm like, what is this guy doing? And turns out that he had experienced this mild heart attack, which had removed him from flying, and he. Later, as we're talking about this, he had admitted that he kind of already had one foot out of the door. But when presented with the fact that, someone else or some other external situation told him that he would no longer be flying, it was sort of like the same, didn't manufacture the joy, but he did kind of reflect on, well, no, like maybe my reasons for wanting to leave were wrong. And I just remember his story of working so hard and enduring so many like ridiculous things to be able to fly. And I wonder, if there's some exercise that would be good for the soul for all of us to do of not imagine. We can never imagine like, oh, I have this terrible terminal cancer condition, but just some sort of mental exercise to really search through and kind of create the balance sheet of contentment or joy that a virtuous occupation has, instead of the easier route of being like, it'd be easier, it'd be better. Like, I'm out of here.
Yeah.
So Peter and his story reminded me of this experience very early on in my flying career. And I'm sort of like playing that through my head.
The question that I thought about now that I've had time to think about it a little bit, that I don't think we have done a good job on any of our podcasts yet, kind of to dive into, is how are your decisions impacting your family?
Oh yeah.
We got to get to that, because
you got to get to it,
because, how did his wife feel about him continuing to work and all that kind of stuff? How did his kids feel? I mean, did they want him to just retire and spend all their time with him now? Or I'd be curious about how the decisions that we make. I mean, I am curious about how the decisions that we make in our journey impacts those on the other sides, and how aware we are of that. We had those conversations. Do we really understand the impact on those people we're supposed to be having meaningful relationships with? Man,
the fact that we haven't done that maybe
tells
that's
us about us, right?
Yeah, man, that's heavy. I think that's a very valid debrief point to take back personally.
Yeah. Okay, that is our show. Thank you for joining us on the 5th episode of the Second Shift Podcast with our guest, Dr. Peter Crane. You can learn more about us and find links to previous shows on our website at thesecondshiftpodcast.com. That's the number 2ND shiftpodcast.com. If you enjoyed the conversation, please subscribe and hit like. And if you're interested in learning more about becoming a financial planning client, you can reach out to us at targetedwealthsolutions.com. That's targetedwealthsolutions.com. Thank you for listening, and we'll see you next time.
The work you did mattered, and you're not done. Welcome to What's Next.
Thank you for listening to The Second Shift. If this conversation landed with you, please download our free guide called The Second Shift Blueprint. 5 questions you and your partner should discuss before any major transition. Get it at secondshiftpodcast.com. That's number 2NDshiftpodcast.com. And if you're approaching a transition and want to talk through the financial strategy, we offer a complimentary 30-minute Second Shift audit. Details are at secondshiftpodcast.com/audit. Join us next week for another great episode. And remember, your life and identity doesn't end with retirement. It's just entering its second shift. The content shared in this podcast is intended for educational and entertainment purposes only and should not be considered personal financial advice. You should always consult with a financial professional to determine what is appropriate for your individual circumstances.